Two common gut health issues, IBS and SIBO, both have very similar symptoms. So I'm going to break them down for you and help you decide if you have IBS or SIBO. So let's talk health. Hi everyone, welcome back to Let's Talk Health. I'm Amanda and I'm going to be breaking down for you the difference between IBS and SIBO. So IBS is irritable bowel syndrome and it needs to meet this criteria in order to be considered that. So listen up and see if you have any of these symptoms. You need to have two or more of the following. So number one is abdominal pain that's related to having a bowel movement. So that means when you go and have a bowel movement, your pain either increases or it decreases. Number two is the change in the frequency of your stools. So that's how often you are having a bowel movement. And then number three is a change in the consistency of your stool. So that means what they look like. This criteria, you have to have these symptoms for 1 day or more of the week for the last 3 months. So for example, if you have abdominal pain, then you go and have a bowel movement and it helps relieve the abdominal pain, that would be considered one symptom. And then also if you've noticed that your stools are more likely to be loose, like a diarrhea type, or they're more likely to be constipation. So that would then be another symptom. So if you had two of those, then you would be considered to have IBS. Those are the main symptoms of IBS: abdominal pain, bloating, constipation, diarrhea, or you can have a mix of both. That's typically the main symptoms that you would have. So let's talk about SIBO now. So SIBO is small intestinal bacterial overgrowth, and that just means that there's an overgrowth of bacteria in the small intestine. So it is a little bit difficult to diagnose. There are some tests that can be helpful. So one is doing a breath test. And this is a test that will determine if you have an excess amount of hydrogen and methane gases in your intestine after you drink a liquid solution. So if you were to be positive for either the hydrogen or the methane gas, then that would show that you do have SIBO. In addition to the symptoms of IBS, SIBO also has some other symptoms. So these are things like nausea, acid reflux, fatigue, having some weight loss as well. And then if you were to take antibiotics and your gut health felt better, then that's also another indication of having SIBO. Some other things to look out for SIBO would be if you ever tried probiotics or probiotic foods and you noticed that you were worse. So this is because you're adding more of that bacteria to an environment that already has an overgrowth of bacteria. So even though probiotics are good bacteria, it is still adding some extra bacteria into the gut, and that can make you feel worse. So that's one thing to keep in mind if you're trying to determine if you have SIBO or IBS. Some other things to look at would be if you're doing IBS treatment and you're not really feeling any better, nothing's getting any better. So for example, there's the low FODMAP diet that's typically used with IBS. If you've done this diet and you're not feeling any better, then that's another indication that maybe you have SIBO. So that diet really does help with IBS symptoms, and if you're not getting any relief, then you might want to do some further investigation. Okay, so here's some other things you want to look out for. So if you've been on long-term antibiotics or long-term acid blocking medication, so any sort of medication that you've used for acid reflux, if you've been on these medications long-term, that's another risk factor for getting SIBO. So if you have gut health issues and you did a long course of antibiotics, then you might want to look into that. Potentially you've wiped out your good gut bacteria and then you got an overgrowth of the bad bacteria. So that's another reason why you might have SIBO. So look into that and see if that's something that sounds familiar to you. Another thing is to look at bloating and how bad your bloating is. So there is bloating with both IBS and SIBO, and they can be after eating foods. But with IBS, you should have some relief in bloating after eliminating some of those high FODMAP foods. With SIBO, sometimes bloating can be so bad that people say, I look like I'm 6 months pregnant that like they're so bloated that their belly is just always hard and distended and even bloated in the morning or bloated after having even a light meal. So that's something to keep in mind when looking into SIBO. All right, so that's the difference between SIBO and IBS. They do look very similar, but you'll want to look out for some of those symptoms that I mentioned that SIBO has, which IBS doesn't have. And you can always do further testing to see if you do have SIBO. So if you found this video helpful, give it a thumbs up to let me know that you liked it, and subscribe to the channel so you can join our gut health community here. I'll see you all in the next video.